Megan. I'm going to be acting as the therapist for our ERP session.
And I'm Emily, and I'm going to be the client.
So what we're going to be doing, Emily's obsession is contamination, and her compulsion is hand washing. So that's what we're going to be working on. Okay, Emily, so we've been working together for a while now. We've gone over your anxiety hierarchy, and we've done some visualization, and you know your relaxation techniques. So now we're taking our next step, okay?
Okay.
So how are you feeling right now? How's your anxiety on a scale of 1 to 10, with 1 being low and 10 being high?
I'm probably at about an 8 or so.
In the 8 right now?
Yeah.
What are you experiencing?
Well, I feel like I can't really breathe. I'm really nervous. I'm like really shaking.
Right.
I just don't like to be in public restrooms. They're really gross.
Well, that's really understandable with your obsession.
Mm-hmm.
And I know this is going to be hard, but I'm going to be here for you every step of the way, and we're going to start our exposure, okay? So what I want you to do, I want for you to touch the flushing mechanism.
I really don't want to touch that. I don't want to touch anything in here. I don't
Okay.
really want to be in here right now.
Why don't you want to touch it?
Because a lot of different hands have been on there, and this is a public restroom, so they've been touching people's bodies, and that's just so gross to me. I don't know what's been on that, and I don't want to touch anything.
Okay, so what's the worst that's going to happen if you touch that? What's the worst thing that could happen to you?
Well, I could touch it, and then I could touch other things. Like I could like drive my car home, and then my car would be contaminated. And then what if I touch my mom, and then my mom's contaminated, and then everything around me is contaminated. And then if I get sick, and then what if something really bad happens to me? And what if I die?
Right. So I want you to, let's take a little minute and do our deep breathing techniques, okay? Does that sound all right? Okay, so breathe in with me. Hold it for a little bit, and out. Very good. So I know this is going to be hard, but I really want you to just put your hand right on the flushing apparatus.
Right now?
Right now. And then just leave it there for as long as you can.
Okay.
Keep going. Good, good. Now leave it there. So what's your anxiety at right now on that 1 to 10 scale?
A definite 10.
A 10.
Yes.
So what are you feeling with that?
I really want to wash my hands. Really bad. I don't want to touch this anymore. I really want to wash my hands.
Okay. So just keep doing that deep breathing. You're doing great, Emily. And how's your anxiety now?
I mean, it's probably like a 9, maybe about down to an 8.
Oh, okay, wonderful. So it's going down a little bit.
Yeah.
And how are you feeling? Can you still feel like you can breathe better?
A little bit.
Perfect. Okay, I think you've done enough. You don't have to touch it anymore.
Okay, so can I go wash my hands?
No, so now I'm not going to let you wash your hands.
I really want to wash my hands.
I understand that that's what you really want, but we are working towards breaking that compulsion.
Okay.
All right? So how are you feeling? How's the anxiety?
Well, now that I know I can't wash my hands, I'm still at about an 8.
An 8.
Yes.
Okay. Well, I'm going to ask you to do one more thing.
What?
I want you now to touch your phone with that hand.
My phone. But I use my phone every day, and I touch it all the time.
Exactly.
It can't be contaminated.
So what would be the worst thing right now if you touched your phone? What's the worst thing that could
My
happen?
phone would be contaminated.
And
And then
then
every
what?
time I touch it afterwards, I become contaminated again.
So I know this is going to be really hard for you, Emily, but this is, going along with the process that we talked about. So I know you can do it.
Can I just wet my hands?
No, you can't. I want you to touch that phone first.
Okay. I really don't want to. It's going to get contaminated, and then everything else in my life is going to get contaminated. Can I just hold it in this hand?
You can start there, yeah. Let's hold it in that hand for a little bit.
Okay.
So how's the anxiety when you're holding it in that hand?
I mean, it's pretty low
Okay.
because it's not touching this hand.
Okay. So let's start out just slowly bringing the phone to the tips of your fingers. Is the anxiety increasing while you're doing this?
Yes.
To what level?
Right now I'm at about a 6.
Okay. So there you go, you're doing great.
I don't want to do this.
And then once you get there, hold it in your phone. Don't let go immediately. Good. So how is your anxiety?
I'm at like a 10.
A 10. What sort of symptoms are you feeling right now?
I mean, I'm really short of breath. I really just want to throw this phone. My thoughts are just like racing. Like everything is just full of bacteria and germs right now. And I really want to wash my hands.
Okay, so let's take this time, instead of washing your hands, let's do some of those relaxation techniques that we talked about.
Okay.
So let's continue our deep breathing. Good. One more big deep breath in. And out. So how's the anxiety now?
I mean, it's probably at about like a 7 now.
Okay, so let's keep doing those relaxation techniques until you get down to about a 5.
Okay.
Okay. So that session was just a brief example of a first time exposure. And normally when working with clients, you would want to, you'd have a prolonged therapy session, as stated before in our previous video, of up to 45 minutes, or from 45 minutes up to 2 hours. And then you would continue working up that hierarchy. So we kind of started small with Emily, and then we would continue working with her until she doesn't feel that high of an anxiety during the exposure.
So thank you for watching our video on obsessive compulsive disorder and exposure response prevention.